Hi dear students, welcome to the class on Fibrinolytics. So at the end of this session, you should be able to classify fibrinolytic drugs, mechanism of action of fibrinolytic drugs, clinical indications, adverse effects and contraindications of fibrinolytic drugs. So these are the objectives you need to learn from this class. So coming to the fibrinolytics, fibrinolytics are also known as thrombolytics. So mechanism of action is basically the fibrinolytic drugs will going to activate the plasminogen, and next what will happen once you activate the plasminogen, will get converted to plasmin, and plasmin is responsible for the degradation or removal of the fibrin. So thereby it breaks the clot which is formed, or it breaks the thrombus which is formed. That's why they are called as thrombolytic or fibrinolytics. So naturally we have got streptokinase which are obtained from group C beta hemolytic streptococci. So once given in a lifetime, there is a development of the antibody against the streptokinase in an individual, and subsequently if you give the streptokinase in an individual who has developed the antibody, it reduces the effects of streptokinase. Dose is 1.5 million international units per hour. T-off is around 80 minutes. So other naturally available fibrinolytic is urokinase, which are obtained from the cultured kidney cells and can be given to streptokinase received patient, and there is no antibody which is developed to urokinase. So next we have a altiplase, which is a human tissue plasminogen activator. We have a retiplase, which is a modified form of tissue plasminogen activator, which is a longer acting and it is given as a bolus. Next we have a tenecteplase, again which is a mutant form of the TPA, long acting bolus fibrinolytics as well, and dose is 0.5 milligram per kg body weight, and it is the most preferred fibrinolytics. So please remember, basically these drugs will directly remove the clot or thrombus from the blood vessels. So we have natural fibrinolytics and recombinant tissue plasminogen activators. Examples are altiplase, retiplase and tenecteplase. So what are the uses of fibrinolytics? They are used in the treatment of ST segment elevated MI, but please remember, fibrinolytics are contraindicated in non-ST segment elevated MI. They can be used in case of ischemic stroke, which removes thrombus and opens the cerebral arteries, but please remember they are contraindicated in case of hemorrhagic stroke or in case of already bleeding patients. Sorry for the spelling mistake. If there is already existing bleeding, it should not be used. Fibrin should not be removed in such cases, because fibrin is responsible for formation of the clot in conditions associated with hemorrhagic stroke. So if you give fibrinolytic, the clotting will not occur and the bleeding chance will increase or will progress. So again it can be used in case of massive pulmonary embolism, which leads to right heart failure and hypotension and shock. So side effects: acute fatal internal bleeding is the risk of fibrinolytic, because you are breaking the fibrin, you are breaking the thrombus. So next, coming to the anti-fibrinolytic agent, or they are also called as anti-thrombotic agent, which prevents the fibrinolytic activity, which these are the drugs which will going to prevent the clot from getting lysed. So basically it is used for control of active bleeding in case of menorrhagia and esophageal varices, and it is also antidote for fibrinolytics like streptokinase, urokinase, altiplase overdose, and it is also more potent and longer acting drugs. So which are these drugs we are talking about? we are talking about the tranexamic acid and the epsilon aminocaproic acid. So tranexamic acid is used for control the active bleeding in case of menorrhagia and esophageal varices, whereas epsilon aminocaproic acid is used as an antidote for fibrinolytic overdose. So this was the objectives which we covered under fibrinolytic drugs. Thank you.